In Australia, it's not clear whether cannabis is a lot stronger than it used to be because we don't have any legal imperative to test for this. So there have actually been no long-term studies of cannabis potency in Australia. We've had to rely on evidence from overseas studies, for instance in the US, the UK, Europe, and there's some evidence in those countries, in fact, that cannabis potency has increased, but certainly not to the level that people have claimed it has increased, say 20 to 30 times. Long-term studies of cannabis potency in the US, the UK and Europe particularly have found that there has in fact been a doubling in cannabis potency, at least in certain countries over a 10 to 20 year period. However, this masks the fact that there is still incredible variability in cannabis potency even within 1 year, and that there are different methods used for assessing cannabis potency. So we don't really know what the doubling means in terms of what people are actually smoking, because these studies come from police seizures typically. And we don't know whether people are smoking indoor or outdoor grown cannabis. So there's a whole lot of factors around those doubling figures that would be interesting to explore further, but we don't have those data. There is not a lot of research on cannabis contamination, although there's a lot of concern, particularly among medical cannabis users, and a lot of sort of anecdotal evidence that people are adding pesticides, fertilisers, particularly hydroponic growers who aren't necessarily concerned with the quality of the cannabis, that they're leaving things in and not observing standard withholding periods. So there's concerns that people are smoking chemicals essentially, and when it burns that these chemicals are causing problems. There are concerns around its potential impact on mental health, and in particular there is concern about mould causing problems, that if people don't store cannabis properly, there's a particular mould called aspergillus which can cause quite severe respiratory problems. But again, there are only isolated examples in the published literature on this, and a lot of it's anecdotal. So while some of it sounds very feasible, we really don't know.